This year's theme is Break the Silence, Shine the Light on Sickle Cell Disease. This day is meant to highlight the struggles of living with sickle cell disease sufferers and their caregivers. Sickle cell is a genetic disease characterized by a mutation in the gene encoding hemoglobin within the red cells. And the result of this mutation is that the red cell loses its smooth circular shape and often assumes a crescent shape, which then results in the blockage of small blood vessels because it cannot move as smoothly as the round shape, so it ends up blocking small blood vessels and capillaries. As a result, individuals with this sickle cell disease often experience chronic debilitating pain, risks of recurrent infections, and other serious complications. Persons living with sickle cell disease are at a higher risk of getting infected with COVID-19 and more likely to get severe illness if they get infected. This is due to their impaired immunity resulting from their blood disorder. People living with sickle cell disease should therefore strictly observe the precautionary preventive measures for COVID-19. During this period of coronavirus pandemic, persons living with sickle cell disease are advised to ensure that they keep a minimum of 1 month supply of medication at all times. In addition, they should consult their healthcare providers should they experience COVID-19 symptoms. At least 240,000 children in Africa are born each year with sickle cell disease. Here in Kenya, it is estimated that 6,000 children are born with the disease. Sadly, between 50 to 80% of these children die before their 5th birthday. The recurrent pain and complications caused by the disease can interfere with many aspects of the patient's life, including education, employment, and psychosocial development. Interventions to control the disease include early diagnosis, provision of prompt and effective management, advocacy, communication and social mobilization for screening and genetic counseling, as well as during premarital courtship. I'm glad to note that the ministry, together with stakeholders, have developed guidelines for managing the disease, guidelines that will be rolled out very soon. This will help us improve the quality of care offered at our health facilities and community levels. I want to thank all stakeholders and partners who have supported the ministry to commemorate this day, particularly the Sickle Cell Federation of Kenya and Novartis. We are also grateful to the Public Health Club medical students at the University of Nairobi who have mobilized their colleagues to donate blood for the management of sickle disease, which is one of the ways of managing sickle disease also involves transfusion of blood when required.